Hello and welcome. I'm Sam Califer, your host for Vision, the show where we talk all about the College of Arts and Sciences as well as its faculty and students. Today, I'm joined by Dr. Gabe Miller, an assistant professor in the Department of Sociology and a core faculty member in the African American Studies program. His work focuses on medical sociology, health inequality, and the role politics play in shaping health outcomes. Thanks so much for being here.
Yeah, thanks for having me. Excited to be here today.
Great, yes, I'm excited to have you. I'm excited to talk about all of your work. But first, I was hoping you could just introduce yourself, talk about your professional background, and how you came to Mississippi State.
Yeah, so I received my PhD in sociology in 2020 from Texas A&M University, where I concentrated in medical sociology, health disparities, and sociology of race and ethnicity. And so my dissertation work there at A&M focused on the political and policy determinants of state-level aggregate HIV/AIDS outcomes, and examining the impact of political policy on those kind of state-level variants and outcomes that we see. So, when I was on the market, I was thinking a lot about location and wanting to end up in a state where I felt that my research and my work could really have an impact and influence policy decisions that were happening. And so obviously Mississippi is I think, an important place to be doing the type of work that I do, as well as kind of the South at large. And so that was one of the big draws of bringing me here. The other was the unique position that I have, which is a joint appointment with sociology and African American studies. And so having, the kind of the two home position was really appealing, and my work is really kind of grounded in Black studies and influenced by Black studies, so that was important to me as well.
Great, yes, we're so glad that you came here and that we can, house you and all of the great work that you're doing. And I find your work very interesting. You take such a novel approach to trying to understand what causes health inequality, and you're really trying to get to the heart, what causes these different trends and health outcomes for different people in the country. So I was hoping you could just talk about that for a bit. What are you trying to discover, and what are the methods you use to do so?
Yeah. So, like you said, my work really focuses on political and policy determinants of health. And I really aim to speak to the impact that policy has on health outcomes and health inequities that we see, really with the goal of being able to impact policymakers and influence policy decisions that are happening at the state level primarily. I also do what I call intersectional health disparity work, where I really think about the kind of multiple modes of domination and how that might impact health. So for example, how racism and homophobia might intersect to create specific health disparities and outcomes for queer people of color. So if we're thinking kind of about the field at large, in the past several decades, the social determinants of health have really told us a lot about kind of what's causing some of the health disparities that we still see, and has really moved us away from thinking about individual health behavior, so things like smoking and drinking. But what I argue is that the social determinants of health have not really gone far enough, and that there's larger structural factors at play, so those things like political and policy factors that also are impacting the health outcomes and health disparities that we see. So I think when a lot of people hear my work, they think that I'm doing like health policy specifically, and that's not necessarily the case. Although, a lot of the things that I look at are specific to kind of health policy and what we traditionally think of as health policy. The majority of the policies that I'm looking at are not health in intent and focus. So they're things like non-discrimination policies, or criminalization policies for HIV/AIDS, policies about like K-12 curriculum, and so on. And so I think if anything, really what my work is demonstrating is that all policy is health policy, even when we don't kind of traditionally understand it as such. In terms of methods, I primarily do quantitative work, although I do some mixed methods work, and I do a lot of collaborative work with other researchers as well. I primarily do kind of what's called state-level panel data analysis, where I look at kind of aggregate health outcomes at the state level for all 50 states across 20 or 30 years to try to have some kind of causal understanding of how policy is impacting these outcomes. I also do work with large nationally representative health surveys that are kind of more individual level health outcomes and individual focused. And so yeah, I think at kind of the end of the day, my broad goals are to identify policies and political factors that really have an impact on the population health curve in a specific way. So I think for other researchers, the approach might be to identify interventions that are important when people are already sick, or when folks have a disease, what can we do to allow them to live longer, where my focus is really on trying to find those interventions that prevent people from getting sick to begin with, and so kind of moving the curve in that different direction.
Sure, that is so fascinating to hear. Really important work. It seems like you are taking a more complete image of this problem and trying to figure it out. And hopefully it has really real world implications, and it can really impact and help people's lives in a lot of ways. So great to hear. And one reason I wanted to have you on, sort of relevant to all of this, you just were awarded a very prestigious grant from the Robert Wood Johnson Foundation to study how political policy impacts the health outcomes of LGBT communities, as well as other marginalized groups. So I just find that to be so important, and I was hoping you could talk about that project and what you hope to accomplish through that grant.
Yeah, for sure. I'm really excited about this work and super excited to have the support and funding from the Robert Wood Johnson Foundation. And so yeah, like you said, this project is examining the impact of LGBT protective policies on kind of a host of health outcomes for LGBT people, as well as non-LGBT people. And so I'm using restricted NHIS, which is the National Health Interview Survey data, which is a nationally representative survey that is administered annually. But what I'm doing is I'm really examining over 40 different policy protective measures that include things like policies and laws that are related to things like parenting and relationships, hate crimes and criminal justice, non-discrimination, religion, school and youth policies, health and safety, as well as a few others. And so what I'm really examining is what impact this host of policy factors have on mental health outcomes, on physical health and chronic conditions, and on health access and health behaviors for LGBT people. And so kind of methodologically, what I'm doing is what we call multi-level modeling, to where I'm able to really examine the impact of different levels of factors on these individual health outcomes. So obviously, I'm looking at state-level factors with regard to these policies, but I'm examining other state-level factors also. And then kind of a level down is I'm looking at contextual level factors, so things at the kind of the county level. So does the health infrastructure of the county impact these outcomes? Does the racial composition of the county have an impact? And then finally, I'm looking at individual level outcomes, so kind of individual behaviors that people have, individual socioeconomic status, race, ethnicity, and those types of things. And with this project, I'm again taking an intersectional approach to really kind of to highlight and get at whether these protective policies and these other factors have differential impact when we consider how racism and homophobia might intersect, or racism and biphobia might intersect. So I'll be looking at, for example, do these protective policies provide the same level of protection or the same magnitude of protection for lesbian Black women as they do for gay white men, for example?
Sure, yeah, and it's great to hear that, and you're looking at factors that people might not typically associate and could have an impact on health inequality, but I think your research shows that it does, and everyone deserves to be healthy. And so I think that's maybe the end goal of yours, is give everyone a fair chance to live a healthy life. And so super important. I think that's something anyone could get behind. So great to hear. And sort of switching gears, with next month, February, being African American History Month, I was hoping you could talk about how your work intersects with African American studies and why that field is so important in our day and age.
Yeah. So as a sociologist of race and ethnicity, I think several of our really critical theories about race and racism are either borrowed or influenced by kind of a Black studies or African American studies approach. And so, as an undergraduate student, I minored in Africana studies, and so was really introduced to kind of this foundation and this core kind of theoretical approach to understanding the world early on. And so, when I was moving into my graduate coursework and graduate degree, I really understood that to truly understand racial disparities and not just racial health disparities, but any type of racial disparity, I think this kind of Black studies approach and theoretically and methodologically is really central and important. And so I think that's really how I kind of found myself with kind of a Black studies approach and centered in Black studies. And so I think what's important is that today, Black studies gives us like the tools and the methodologies and the theoretical understanding to really approach and kind of explore what the social phenomenon that's happening. So if it's things like racial health disparities or the inequitable impact that COVID has had on the Black community, or even the insurrection that occurred last year, I think African American studies gives us the toolkit to really be able to understand and explore those things, and not just history, but also what's happening in the current moment.
Sure, yes, I totally understand that. It sort of gives you the right mindset and the right theory, to tackle and try to analyze situations that are similar. And it gives you the right kind of approach. So fascinating, and it's so important, with next, that coming up next month. So that's great. And, just to end, if maybe there's someone listening right now, they're interested in getting involved in all of this work, all of the interesting research going on in the Department of Sociology, the African American Studies program, what advice would you give them to get involved? What opportunities are there, and how could they plug in?
Yeah. So, the obvious answer is, sociology and African American studies provides a lot of important coursework for our student population. And so just kind of on an easy surface level, I think getting plugged into our courses can really answer a lot of the questions that we're getting at. That you can also minor in African American studies, and I think minoring in AAS really would give students kind of that toolkit that I was talking about. So having the theoretical and the methodological and kind of a foundation and approach to be able to understand what's happening in our social world today. We also in both the sociology department and AAS program, we do a lot of important programming. So all throughout Black History Month, there's lots of programming happening, but also throughout the entire year, we bring in really important people that are doing groundbreaking research on kind of the disparities that we see and other things that are associated with African American studies. Aside from kind of the courses and programming, I think what many students are not aware of is that there's opportunities for student research in both sociology and African American studies as well. And so there's several AAS affiliated faculty who are willing to bring undergraduate students on to do original research or to help them with ongoing research that they're doing. So for example, right now I'm working with 3 students. One of them is working with me on some of my own projects, but 2 of them are doing original work that they're presenting in a conference later this semester. And so I think there's opportunities to engage in research with faculty in both places as well.
Sure, yes, I think they are interested and want people to reach out and get involved. So great to hear, and I hope if anyone's listening and they are interested in that, I hope they will do that. And I just want to say thank you so much for joining me today and talking about all of these important issues. And thank you all for tuning in to this episode of Vision. We'll see you next time.